Come on, brother, I'm going up to 4, I'm going up to 5, I'm going up to 3. I get questions about which ribs are reached in Ribella. Traditionally, as has always been explained before, it's the removal of those floating ribs, the last 2 ribs. We adapted this to Ribella, but we also stated that we could reach higher ribs as well. We stated that we could go from 9 to 12 from the back and from 7 to 10 from the front. Of course, this suddenly became a hot topic everywhere. Come on, brother, I'm going up to 4, I'm going up to 5, I'm going up to 3. A doctor abroad said, I can go up to 4. He said, friends, it doesn't matter how high we can go here. I can go up to 2 as well, it's no problem at all. So if a plastic surgeon can go up to 4, it's not an issue at all for a thoracic surgeon. Here's the problem. When you go above the diaphragm, you're taking away from the limited volume of the chest cavity. You know, since we also deal with pectus, why do we treat pectus? It takes away from the volume of the heart, lungs, diaphragm, in other words, the intrathoracic organs. When you narrow that space, the volume of the organs inside the chest decreases. But the abdominal cavity is different. In the abdominal cavity, the organs can find a place for themselves. You know, when a baby is born, the baby grows and grows inside the mother's womb, but even so, it doesn't put pressure on any of the abdominal organs. The physiology of the abdomen is designed for this. But the physiology of the chest is not like that. That's why we try to stay below the diaphragm. We have the patient get a CT scan. On the CT scan, it's usually around the 7th rib, so we say 7. But for example, with very tall patients, I've gone up to 5. It's not because we can't go higher. And on top of that, consider this. We put a lumbar corset on the patient, right? So that it fits tightly. Now, if I go up to 4, then I won't be able to put a corset on afterwards. Why won't I be able to put it on? Look, the rib cage needs to be able to flex, but I'm going to disrupt that flexibility. The patient's respiratory functions will be impaired. That's why we can't make a corset up to here. We can't put it on the patient. So is there any point in operating on a level where I can't put a corset on? Of course not. So please go see a thoracic surgeon. This isn't something you do by rote, like I went up to 7, I went up to 5. It's not the stock market. This is something that needs to be done consciously, purposefully, and in a measurable way.